So welcome, welcome. Thank you for joining me today, Dr. Abenaa Brewster. And I would like to, full disclosure, you're my sister-in-law. I'm so happy that you agreed to do this.
Oh, you're welcome, Dr. Satcher. Happy to do it.
Yeah. I'm going to introduce you just briefly. Dr. Abenaa Brewster is another Harvard Medical School graduate, and she did her residency in internal medicine at Johns Hopkins in Baltimore, Maryland, and did her fellowship in oncology there as well. And then she also got a master's in epidemiology at Johns Hopkins. And I want to mention that Johns Hopkins has been one of the premier epidemiological studies universities involved with mapping the numbers from the COVID-19 virus. They're like number one, and which is great.
I know I look at their data every day, and I'm very proud that they've taken the lead in terms of really giving us an understanding of the impact of COVID-19 around the world.
Yeah, so I just wanted to briefly state why I'm doing these interviews. I'm doing these interviews because I felt like a few weeks ago, I noticed that nobody was really talking about people of color or melanated people and how the virus is affecting our communities. And I wanted to make sure that our communities that we could get the word out to these communities, and just probably it's like reinforcing what CDC is saying, just reinforcing what they're hearing on TV, but also just from the perspective of people of color. Because I think that, of course, we all relate to each other. It's also good to see my colleagues and people that I know in areas of expertise and be able to share that expertise with the public, because I think that the public is appreciative of this information, whatever we can provide.
Yeah.
So the first question I'm going to ask is, what is the typical type of patient that you see on a day-to-day basis?
So my practice is mostly patients who have breast cancer, either newly diagnosed or metastatic breast cancer, and I care for them, and I'm often the lead for the teams that are needed to execute their care.
Mm-hmm. And what is your recommendation for people of color who are also cancer patients with compromised immune systems to avoid and prevent the virus?
Sure. Well, I think, what's probably unique about individuals of color is that we're more likely to have comorbidities like diabetes and hypertension and asthma. And so then when you put cancer on top of that, especially if you're receiving chemotherapy or immunotherapy, then it's kind of all of the risk factors in terms of increasing your chances of maybe becoming infected and not always having such a great outcome. And so I tell my cancer patients, social distancing is very key. A lot of them are self-quarantining. And I definitely agree with that recommendation. I say, if there's somebody's got to go to the grocery store, it shouldn't be you. Have the other family members engaged in all of the CDC recommendations of, washing your hands frequently, not touching your face. Now, the recommendations have extended that if you're going out to wear a cloth mask. And so those are all suggestions and recommendations that we strongly encourage our cancer patients to follow.
Mm-hmm. And should one of your patients come down with COVID or get diagnosed that they've been exposed, have a positive test, what is your advice like once that happens to them?
And of course, everyone needs to check in with their healthcare provider if they did get tested outside of the health system and have a positive test. And it really depends on the symptoms. If your symptoms are mild, usually the recommendation is to be at home, self-isolate, self-quarantine, and kind of ride it out. But certainly if you have any of the warning signs, shortness of breath, high fevers, not being able to keep fluids down, chest pain, any of those warning signs, those are indications indications that you need to get to a higher level of care. And I always just encourage that if you're going to go to the emergency room or urgent care center, to call ahead so that the doctors, they are prepared for you when you come, and they can be appropriately protected in order to be able to give you the best care. So always kind of keep in touch with your healthcare provider and follow their recommendations.
In your area, you're in Texas. Do you all have any of the testing centers that have been set up that are kind of
We do.
off-site or in front of the ED so that people aren't going in
Absolutely,
the hospital?
absolutely. There's community testing that's occurring, and then of course there's also testing that's occurring for patients who are already integrated into healthcare systems, who might be symptomatic or who might need testing because they're about to undergo any variety of procedures.
Okay. And just on the topic of your region of Texas, what do you all have the shutter in place orders or lockdown or anything going on?
We do in Houston, we're a shelter in place. And so it's very visible that there are not a lot of people out. You know, grocery stores are empty, and, you know, the big Galleria Mall, there's, you know, it's closed down, and the movie theaters. So the town is a bit of a ghost town, but that's a good thing, because the more the town is a ghost town, the more lives we'll hopefully save.
Are people down there cooperating? Because I was talking to some colleagues of ours in Mississippi earlier today,
Yeah.
and they're kind of concerned because what they were saying is that, especially it wasn't just people of color. They said across the board that there were a certain segment of their population that didn't believe that coronavirus was actually something they should be afraid of. They thought it was a hoax. So,
well, you know, I haven't seen that being reported for the Houston community, and certainly I can say that the patients that I take care of and the cancer patients are taking this overall very, very seriously. And so I think it
as they should.
depends on, you know, how people view their risk. And if you think your risk is high, then you absolutely should be taking this very seriously.
Mm-hmm, mm-hmm. So, you know, I'm specializing in functional medicine in addition to other things, but I know that many people are running out and buying supplements, and that they don't really know about the interaction of the supplements. And I always tell people that are on chemo that they should check with their doctors. So regarding your patients, how would you advise them regarding, you know, just buying random supplements?
Right. Well, you know, you're the expert, but I absolutely agree. We don't know how some of these supplements or antivirals might interfere with chemotherapy. And so before you start self-prescribing either supplements or other types of treatments that you think might help, for absolutely you need to speak with your healthcare provider, because during this time, you certainly don't want to cause complications that are unnecessary while everyone is really kind of focused on making sure that our cancer patients are kept safe.
And I know where you are, you guys have people in my specialty around in your community, so you can refer them, like if they really wanted to know what supplements to take.
Absolutely.
There are doctors that can help them, right?
Absolutely. And we're using virtual care more. And so some of those doctors may have opportunities for virtual care so that it's a phone call as opposed to going into yet another doctor's office. But yeah, you've got to get educated and really at this point in time, reach out to the experts as opposed to taking matters into your own hands.
What's kind of the patient demographic mix where you are? Because what I was talking about now, there's data coming out of Louisiana and Detroit about the racial disparities, the health disparities, and the feeling is that the disparities probably were happening like on the front end with the testing because of the questions that comprise the, you know, the questions that had to be answered before you could administer a test, and that may have skipped over a lot of people of color. And then they also had some gatherings in Louisiana. They had the Mardi Gras,
Mm-hmm.
and they think that might have contributed. But what they're seeing is that not only their higher numbers with the demographics of people of color, but they're seeing a really high death rate in comparison with the rest of the population.
Mm-hmm.
Is that a concern where you guys are? And like, what kind of percentages with the patients would you say?
Yeah. I don't know that data. And
Okay.
so, but I know that, for community testing, it's very important to be able to reach all segments of your community so
Mhm.
that you don't have those disparities in terms of who gets tested and who doesn't, and then who's able to self-isolate and not. And so I think on that level, on a population based on our community level, it's really incumbent for the public health officials to make sure that the testing opportunities are equitable.
And knowing that you're an epidemiologist and that you understand all the terminology about the curve, I think most doctors understand the basics about the
Yeah.
curve.
Yeah.
But how long, because like in New York, for example, they seem to be seeing a flattening this weekend, or they're thinking they may be seeing it.
Mhm.
Like how much time do you, and I remember when this happened with China as well.
Mhm.
And I wondered like how many days do they want to see? And it's probably related to the size of the population and other variables, right?
Yeah, I mean, I would be honest, I don't know the answer in terms of how long is the duration of flattening to give you the confidence that you're really seeing a flattening, but I would
Mhm.
assume that it's got to be more than a few days and
Yeah.
that you really have to kind of see something that looks pretty sustained to feel confident that
Mhm.
you've gotten a handle of the situation.
Are you guys on the upswing there yet, or it's
Yeah, our peak for surge for cases in Texas is expected to be the first week of May, and so our numbers right now are I think we're about 12th in the nation in terms of cases, and so I think a lot of the sheltering in place that's occurring in some of the major cities in Texas has certainly helped, and we hope that it continues to to um, to help decrease the number of severe cases that we have. But yeah, we're still a couple of weeks away from our surge. And so everyone is still very much in preparation mode and obviously taking care of the patients now who need the help.
wow, yeah, you all have some time to go,
Yeah, yeah.
unfortunately.
Yeah, we do.
Yeah. So is there anything else that you wanted to comment about that I
No,
haven't
I just,
asked?
I think that cancer patients are scared, and a lot of changes are being made in terms of postponing surgeries or delaying chemotherapies or making adjustments in radiation plans. And so I know that can cause a lot of concern among patients. But, I just want to reassure them that all of these decisions are being made in a very thoughtful manner, gathering the evidence everywhere that we can, with several disciplines discussing all the adjustments that are being made. And at the front and foremost of all of these changes that are being made is patient safety, and still recognizing that cancer is serious and that we all want to have the best outcome for our cancer patients. So I would just like to kind of give the cancer, patient community some reassurance, because I know that it is pretty scary.
Yeah, and that's why I appreciate having you on here so much, because there are so many cancer patients out here. A lot of just in the medical community, like I think we know there are a lot of cancer patients, but I think the public doesn't realize that there are a lot of cancer patients,
Right. Yeah.
yeah, that are at risk. So thank you so much.
You're welcome,
Thank
Dr.
you.
Satcher. This was a pleasure.
It was.